I'm Andy Orm of O'Reilly Media. I'm talking with Nelli Lähteenmäki of Health Puzzle, which is a startup. Like many other startups these days, is taking data, fitness data, personal data. But what differs with Health Puzzle is that they're also using genetic data, which I think can make some interesting and very powerful combinations. So Nelli, tell me a bit about how you're combining these different types of data and how people can use it to make for better health.
Okay, thanks, Andy. So basically, as I said, Health Puzzle is an early stage startup based in Helsinki, Finland, and we're basically really making the most out of the existing technologies, existing health applications and sensors and devices that with an open API, like many of our of other startups are doing. So integrating the exercise data with nutrition data, with sleep data, with things and Fitbits and all this stuff, and combining those data streams with the genome information. And where we see, why do we basically take the genome information into the picture is we all know that genetics and genome can reveal many interesting things for people about their natural traits and increased risks of certain diseases. So what if we could incorporate that data into the kind of goal setting approach in kind of helping people to lead better lives and set goals that help them stay happier and healthier longer. So kind of we're just taking that extra piece to the puzzle that we really feel that it should be in place. But there's also not only the preventative side for consumers to stay in better health, but there's also the other side of the picture is that we see down the line that not only developing mobile apps for consumers, but also developing an interface for doctors. So say if you had used the Health Puzzle health data recorder for some time and your doctor was part of the Health Puzzle network, wouldn't it be cool that he could use the Health Puzzle tool to treat you better, not based on the immediate symptom, but what's the lifestyle behind the symptom as well as the genetics behind the symptom. So we really wanted to take it to the next level and take it a step further.
And doctors will be interested in questions like what are their high-risk populations? So
exactly.
If people are using your service, the doctors might be able to do that.
Exactly. So actually the whole project started as a striking need of a medical doctor and a scientist back in Finland. Mm-hmm. And he really was like, I need this kind of a tool to serve my patients better. So, mm-hmm. Let's work, our way to make it happen. And we, however, decided to take the consumer approach to start with because we really feel that, if we don't create an application that's friendly and easy to use and kind of intuitive to use for consumers, it will never, people are not going to be willing to start nurturing our database with their information. So.
Since there are so many companies that are interested in similar things and collecting data, we don't want to create more silos.
Yeah.
So are you going to provide it in a fairly open way and allow other people to write apps to your data?
Yeah, absolutely. So basically, our API is going to follow the open data protocol. That's very important for us. That we don't want to be another new API to integrate with. So basically, we're definitely part of that movement.
Another question I've had is about how much you can trust data, especially about genetic diseases. There was a talk a couple evenings ago about how 80% of research in medical journals cannot be reproduced. Mm-hmm. And I wonder, when you take information, offer it to patients, how do you say, yes, you can trust this?
That's actually a very, very valid question. So basically, we are in the first steps of our database and of our platform. We are aiming to do things better. So of course, because it's a self-learning system. So the more data we create, hopefully, the more useful connections and the more new science we're going to be able to produce to the world, and which are also going to be open, of course, for researchers, for them to take advantage of it. But of course, like many other players out there, we're going to integrate the latest research data to the platform, and and of course, of the historic research data too. But as you said, there are things that are not, correct or outdated, or are low, some genetic research that is local, to some place, one corner of the globe, and it's not applicable all around the place. So hopefully we're going to collect the best bits and pieces of the current research, and down the line, we're going to be able to create some research, new knowledge and information through our system.
Well, thank you for coming in. I look forward to seeing where this project goes.
Yeah, thank you so much for the opportunity to talk with you. Thank you.